Hi, everyone. Thanks for tuning in tonight. My name is Jessica Pawlicki. I'm a nurse practitioner and owner of Functional Medicine by Well Rooted. Some of you may recognize who I am. So I wanted to come live on this page because there's not a lot of following on this page, and I want to introduce who we are, what we do, and why we do on the functional medicine page compared to where we are on the other page. So for those that don't know, I also own Well Rooted Pediatrics in Crystal Lake, where we focus on functional medicine and integrative pediatrics. And what's unique about us and different about us is that we are consistently finding what the root cause is and being able to treat that with more of an alternative approach. It's very rare to find in pediatrics, and that's why I opted to go this route for me and my family after going through courses and courses of doctors that told us that we needed to do things one way or we didn't have choices, we didn't have options, whatever the case may be. And then I started seeing kids in the pediatric practice that were super sick or just were medication after medication, antibiotic after antibiotic, and they weren't finding out what was actually the problem. So I went on my adventure through the functional medicine integrative route, and I went and opened my own practice, which we've had for about 18 months, and we have over 2,300 patients in that practice in Crystal Lake. So in July, an opportunity came to me for me to take over the functional medicine office in Woodstock. And it's been going awesome. Patients are, just super thrilled at how we completely redid the office and how we have taken a different approach into this healthy living lifestyle. And what's really important to remember is that everybody at some point will be faced with a challenge. If it's not a chronic disease, if it's not an illness, if it's not a family member, a parent, a child, whatever the case may be. And so knowing that you have different avenues or different options for your health is super, super important. And as a provider and as a mom and as a wife, I did not know that at one point. I did not know that, there was a different option. I did not know that there was something besides medication. I did not know that there was chiropractic that could help X, Y, and Z. I didn't realize that gut health was that important. Like there were so many different things that I was unaware of. So my goal is to educate everybody as to why that is a big deal. So what's really awesome is we've been seeing a lot of families from the pediatric office in the functional medicine office just because parents are finally taking the initiative to put their health first after we've put our children's health first for so many years. So I just wanted to be able to come on, introduce myself, why I do what I do, a little bit about me, and then kind of just talk about this practice and why it's unique and why it's different, and what our plan and goal is for our community. So I already introduced a little bit about myself and the other practice. I have two children of my own. I have a 4-year-old boy and a 6-year-old daughter. And my daughter is definitely the one that led me to this challenge. I had actually faced several challenges getting pregnant with her, some infertility issues. And one of the things that stands out in my mind is after 3 miscarriages, they finally did like an MTHFR panel. And they said, well, you have MTHFR, but it's not relevant and it's never going to affect you. That stands out in my head to this day. And what I know now, I should have had them run a homocysteine. I should have had them check my detox pathways. I should have had them check my thyroid, so many different things, and no one did. So I took matters into my own hands and I went the integrative functional route and I did abdominal therapy and I did herbal route and we ended up getting pregnant with my daughter. And after that I realized that there was challenges that I had that nobody could help me with and there was no one around. I mean, you had to Google these people and it was very hard to find. So I said, I need to stand out and I need to be, in the forefront. I need to be there for these families. I need to be there for the community. So again, when this opportunity arose in July for me to take over this functional medicine office in Woodstock, I jumped at a beat of a heart because I knew that this was my opportunity to reach more families, more people in the community, and really get somewhere with it where people could not have chronic illnesses, not have chronic diseases, not be dealing with obesity, not be dealing with recurrent illnesses, whatever the case may be, especially in this time where everybody is being faced with challenges or anxiety, depression, stressors due to the pandemic, due to COVID, due to work stressors, due to school stressors of kids being home with e-learning. now is the time to jump in and really help people as much as we can. So I just kind of, again, just wanted to throw that out there. That's where my passion is. That's where I started, and that's where I'm here today, and that's why I'm here today. And people that know me and that have seen me know that, number one, I'm talking really, really fast on this video because I'm really good at that. Number two, that I'm so passionate about what I do, and if I don't have the immediate answer, I will never tell you that I don't know. I will always find out. And I will continue to dig to figure that out, because if you as a person comes to me with a complaint or a concern, I will never neglect you. I'm always going to listen. I'm always going to make sure that your answers are there and that you're comfortable with our plan of care, and it's a unified plan of care, and we're going to move forward with that together. So again, those that know me really are aware of that, and they know that this is nothing new and that approach has not changed coming to this office. So all right, so a couple things just to kind of throw out there. So this office operates the same as the pediatric practice. We are a fee-for-service clinic. So what that means is that we are cash up front, and you can submit a super bill to your insurance for reimbursement. Now that goes for all of our visits in office, that goes for all of our IV therapies, etc. I would tell you most people have a lot of success submitting super bills in this office due to the fact that we can really tie it to an ailment, a chronic disease, or a condition. So if we're doing chelation therapy and we're doing heavy metal testing, we can state that yes, due to this toxicity of metals, we need to perform chelation, and that's getting covered that way through insurance. So we will help you to tie that together. And my team at the office is just really awesome. We have a nurse and a CNA who who put together all of our IVs, extremely trained and knowledgeable, and completely just will help you at any point. So they will help you, guide you through that process to make sure that you have the most optimal outcome for reimbursement. But the reason that we do that, and I want to make this really aware too, it's not because we need your money, okay? The reason we do this is because insurance will not let us do what we need to do functionally or integratively or alternatively without dictating what we do. I don't want to be dictated. I don't want an insurance person who's sitting behind a desk, who's sitting there typing at a computer when you call, saying, oh yeah, no, you can't have that treatment because your plan doesn't cover that, or you need to switch this medication because this one's better, when really they're not the same thing. I want this one. So I don't need someone telling me all that information. So we do our best to definitely serve you and make sure that we are always at just that optimal end so that we don't have to deal with that. And that is by definitely being fee for service. So again, those who've been a part of the practice know that that is definitely our biggest thing that we focus on, is you and your care at all times. So that being said, so a lot of people ask me, like, what is functional medicine? What do you do? Why do you do it? So I've had a lot of these conversations with people recently. We just switched our POS system in the office. So the way that we're taking payments and stuff. And he goes, so like, what do you do here? What is functional medicine? Like, people truly still to this day, they don't know. And if it's not the lifestyle you've lived, or if it's not the lifestyle your family's even been a part of, how are you going to know? So I always envision a tree. So those, again, that know my other practice know that our logo is a big tree, and there's a reason behind all of that. So if you picture a tree, you can picture, obviously, roots into soil, the tree trunk, branches, and leaves. So a good way to kind of remember or picture what I'm trying to explain is that the branches of the tree, call it diseases, chronic illnesses, obesity, whatever the case is. The leaves are all the medications that they give you for each illness. So if we have a branch for high blood pressure, and then we have a branch for cholesterol, and then you have, a statin, and you have an aspirin, and you have a hypertensive medication, and you have all these different things. Okay, so that's the top of the tree. And then you have the trunk that obviously takes all the nutrients from the soil. In the soil lies the root cause. So when you're going through conventional medicine, they're just looking at what's above the ground. They're looking at the branches. They're looking at what medications they can give you. They're adding leaves to your tree. Eventually, the leaves fall off, and then the branches die. And if there's nothing good in the soil, the tree dies as well. So that comes down to our health and what we need to do as people. And if we want to follow that, then that's fine. I'm not here to change that. But if you're coming to me, I will tell you that that's not our approach. So we will figure out what is causing these branches to be inflamed. What is causing these branches to have these issues? I'm not going to go the leaf route. I'm not going to just keep throwing medications at you. There's a time and a place for certain things that we do medications for, but it's not the majority of what we do. So then is what we're doing is we're digging into the soil and we're saying, okay, well, I'm going to dig down and see like what's causing that high cholesterol issue. Is there a microcirculation issue? What's causing that heart attack? Was there a buildup somewhere? Was your LPPLA2 elevated, which is your plaque buildup in your arteries? Is your MPO elevated, which is the lining of your arteries? What is it and why? Why is that inflamed? Do you have an autoimmune issue? Do you have Lyme? Do you have a chronic viral infection? What is it? And then when we find out what that is, which everything is drawn at your initial appointment, we're able to do the full panel of labs. We're able to look at all of that stuff, which all go through your insurance, by the way. So your labs are not cash pay, just your visits cash pay, and all your labs go through your insurance. So we draw all of that, we analyze it, I put a plan of care together, and then I say, hey, this kind of makes sense. Here's a lot of your symptoms. Here's what's showing up. We also do wellness visits. You're a healthy person, right? You just want to make sure that you're staying healthy and that you don't have anything underlying that maybe isn't evolving into symptoms yet. We can do a full wellness panel, same labs. We check all of that stuff. We get one visit instead of two, and we go over the results. And I say, hey, yeah, you look really good. Here's a couple supplements that maybe I'd recommend you take. Or, you know what? Hey, look what we found. This is a calm before a storm. Your bucket hasn't tipped over yet. It's filling out, but eventually something's going to tip it. Is it going to be a loss of a job? Is it going to be a loss of a parent? Is it going to be a chronic illness? Is it going to be a pandemic, a stressor, a trigger? Something will tip your bucket. Don't allow something to tip your bucket. Get in and get your visits done and do your due diligence for your family, your friends, and make sure that you don't have something underlying that's sitting there. And I can't tell you how often I see this, which is why I get so passionate about it and I get so intrigued by it, because I literally find something every day where I'm like, hey, this is what's going on, and this kind of makes sense, and here's your family history, and you already are at a higher end for this stuff. Like, let's prevent it. You have 3 kids at home, you have 5 kids at home, you have a wife. You have people that you have to live for. So don't take the opportunity, don't miss this opportunity to get yourself checked. And just because you feel fine, you may not be fine on the inside. That is functional medicine. Looking into the soil, looking at the root cause all the time, always, 100%. And that is what we do. And, everybody's different. And it's nice because we individualize a plan for every single person. So there's no blanket plan. Excuse me. There's no blanket plan. There's not a supplement for every single person that we give. There's not a protocol for every single person that we give. There are providers like that. I know them. I've had patients switch to us from those providers because every single patient gets the same list of stuff every time they go in there, and that's not how we run. So we are focusing individually on you. And again, if we are stuck, if I'm unaware of what to do next, if I'm kind of like, whoa, this is an interesting scenario, I will never tell you that I don't know. I will always tell you that I don't know. I will never say that, no, yeah, everything is fine. I will say, you know what, I'm going to reach out to so-and-so. I have a higher person here who's got a much more experience, and we're going to try to work through it together. And that is what's important about a healthcare provider, is that someone's always listening and always trying to figure it out for you. So that's a little bit about the functional medicine side and what we do there. Another big part of what we do in the office is IV therapy. So IV nutrient therapy can be given in many different ways. So we have several different protocols that we do in the office. And the one thing I like to disclose is that we're not like your Jamba Juice for IV therapy. So you can't just walk in and be like, hey, I want that hangover bag. Hey, I want that's not how we work. There are IV clinics like that. That is not practicing medicine, in my opinion. That's not chronic disease. That's not chronic management. That's not functional medicine. That's just a task, okay? So for us, we're analyzing, we're making sure that is right for your body. So once you're an established patient and we go through your labs and we figure out your protocols, I mean, we have just immune boost IVs that we recommend based on your labs. We have vitamin C protocols for those who have positive autoimmune diseases. We do chelation for those who have heavy metals or microcirculation issues or cardiovascular disease, diabetes. We do blood vessel restoration for those who have high MPOs or high LPPLA2s that have plaque buildup in your arteries or have had a cardiac inflammation. We do multivitamin bags for minerals and mineral repletion after, if we've done chelation or if we're just really depleted in a lot of that stuff. We do stress executive IVs that really just, boost the times where, hey, your labs maybe look good, but maybe we have high stress jobs or we're just a very anxious person or we need those types of things to help us. Like we offer those types of protocols. But no, you can't just walk in and get an IV and think that that's going to help you. And that's why we don't allow you to do that, because a one-time thing isn't going to help. Now, studies show IV therapy, you can do IV therapy for 1, 2, 3 weeks, and you can get the same results as you would get by taking an oral supplement for months to years. So weeks to months and months to years is the difference between IV nutrient therapy and obviously oral therapy. And it makes perfect sense, especially if we have like any like GI issues or any like GI that needs like restoration or poor metabolism issues. Of course, your supplements are not going to digest as well. So we try to do nutrient therapy as much as we can, and we get in there and we get in there quick. And sometimes we don't have much time to work with. But I've had people who have had like really poor ejection fractions with their cardiac function who have completely gone up because we've restored their lining and we've rid the plaque out of their arteries, and no supplement ever would have done that. They would have been put on beta blockers and they would have been put on aspirin and they would have been put on a statin. They would have been put on all these things with all these side effects, but no one would have fixed the issue, right? So again, lots of different consults, lots of different treatment options. The supplements that we recommend and that we use in the office, we know exactly what's in them. They are our brand. They are made very, very closely in a compounding pharmacy down in Florida. We know exactly who came up with the protocols. We know exactly what is in them, and we know the exact pharmacy that makes them. Very, very important. And that's why we stress too, like the Amazon products and different things from different stores. Like you don't know what's in that stuff. We will try to compare as much as possible if you didn't want to use any of our supplements in the office, but we have the best success with people in comparison that are taking our supplements versus those who are taking their own. And I have seen that comparison. I've done full labs on people and then done their repeat labs in 3 or 6 months. And I'll be like, well, your cholesterol didn't change or this didn't change. And they've been following this diet and they've been following what they were supposed to do, but they weren't taking the proper supplements, right? So there's a time and a place, but we focus on that entire thing. So we'll help you with the diet plan. We're going to help you with the food plan. We do food sensitivity testing, heavy metal testing. We do the IGenics for Lyme disease. We do Genova stool testing. We can do neurotransmitter testing. You name it. We are figuring out exactly what's going on. We're coming up with the plan, and we're really just honing in on that. And again, that is the biggest thing that, the first thing, when I took over, I had my parents come in, I had my family come in, I had my grandmother come in, I had my husband come in, like everybody that's close to me. I'm like, let's do this. Like, I want you guys to be healthy. I want you guys to be strong. I want your immune systems to be great. How could I sit here and not take care of the people that I love most and put them, excuse me, put them through these protocols and this type of stuff if I didn't believe it? So I can use their situations and I can say, hey, X, Y, and Z. I've seen this stuff happen. I've seen this stuff evolve. I've watched patients come in almost completely bedridden from anywhere from 30s to 80s. Completely just miserable, bedridden, lots of issues. We figure out exactly what's going on. We start treatment plans, and these people walk out at the end of the day of their treatment plan within, 4 weeks. They feel amazing. That is why I do what I do, because I see it work and I see it happen, and I'm so passionate about it. And we have a lot of growth to do with this practice, which I super can't wait to do. Over the next year, we will plan on combining both offices under one roof. We plan on doing a lot more growth and a lot more building for the community, and I really cannot wait to do that. A lot of people have asked me about hormones and if we do hormones, and we absolutely do hormones. Hormones are tricky, and you have to have someone that actually has a clue about how to do hormones or what you're looking at. So again, we really just focus on, whatever way we need to go. So when we're doing your hormone workup, which is in your initial labs, we can determine, okay, you're lacking this, you're too high in this, this is where we need to be, and we come up with a protocol. We do bioidentical hormones. We do pellets if needed. We do creams and capsules from compounding pharmacies. So again, very individually based and all based off of your labs, what you want and what type of protocols that will fit you personally. So hormones are something that we do in the office. During this whole pandemic, again, like I kind of mentioned earlier, when you look at the statistics of the people that were affected the most, they had tons of comorbidities, right? So was it high blood pressure, obesity, diabetes, cardiac disease, cancers, whatever the case may be, okay? Their body was compromised. Sure, was there healthy people that, that actually died from this virus? 100%. There is. There's nothing that neglects from that. But in my opinion, that can happen with anything. There's healthy people that die from influenza every year as well, okay? So we need to be open and honest about that. But the biggest thing I want to say is if you're seeing that the most of the people affected are those who have these comorbidities, those that have these illnesses, those that have these chronic diseases, wouldn't you want to rise up and be against that statistic? Wouldn't you want that to not be you or your family member or your parent or your husband or your wife, your child? I mean, I sure don't. So that's why, like, I got everybody in as soon as I could. I'm like, you guys need to get on this. You need to start treating. There was family members that were completely healthy, and we found things that need to be fixed. Statistics show, and there's studies that show that these things cause more issues later on down the road. And when we see our people that came in and they had an aortic aneurysm or they had a heart attack, and now they're coming in because these things happened to them and they didn't think they would, we find the problem in their work, in their blood work, in their workup, in their history, and then we pinpoint it. Well, could that have been prevented? I'm not God. I can't tell you that. I don't know. But does it kind of lead that way? Possibly. Inflammation is everything. If you guys follow our page, you see that I was posting about root canals. It's a whole nother topic of conversation right now, but inflammation and necrosis and dying tissue and all of that is everything that could potentially cause so many things down the road. Don't be a statistic. Don't be one of those people that, were affected by different viruses or illnesses because you weren't healthy, because you had diabetes that was uncontrolled, because you didn't put your health first, because you had, all these different things that you knew you could fix. We're here to help you. And so that's why I always say, like, share our posts, share our page. You guys do not, that is how I eventually got into all of this. A girlfriend of mine up in Michigan, she shared stuff to me religiously for weeks. I didn't think I was ever going to listen to her. And then I finally looked into what she sent me, and I was like, oh my gosh, she was right. This is crazy. And then I didn't stop from there. It was one rabbit hole after another. I mean, I just kept digging and digging. So if someone didn't share something with me, I never would have been in the seat that I am today. So that's where I say I don't need, followers on social media. That's not why we tell you to share this stuff. I tell you to share this stuff because I need you to let somebody else that maybe will not reach out to you. I need someone else to see that maybe they have an illness or their family member or their aunt, their uncle, child, whatever, has something that we can help with, and that is why I'm here. Because this community, we need to stick together because there's not much keeping us together in the state of Illinois right now. So us healthy folk have to definitely stick together, and we have to make sure that we are just always on top of it, and that we make sure that our closest people, if it's not our neighbors or whatever the case, are getting the best care that we can. Not everybody's going to be on board with it, okay? And if that's the case, you did your best, you did your due diligence, and it's fine. And like I said, don't hold it over your head. Don't be, don't consider it a burden. It's just you did more, did better, and that's okay. We all have lived a lifestyle at some point, and that's the biggest thing I say with my daughter. It was a learn more, do better. If I didn't do what I did at that point or knew what I knew at that point, I wouldn't be where I am today. So we have to use those as educating experiences And I tell parents like that stuff all the time in the office. They have so many regrets for certain things, or they wish they didn't did this, or they wish they wouldn't have done that, or they wish they would have researched that. It's to learn more, do better. And that is what we can do as parents, as humans, as daughters, as sons, as whatever the case may be. But we have to continue to grow that lifestyle. This is what's going to keep us around. This is what's going to keep us thriving. And this is what's going to keep us healthy on a regular basis is functional medicine, finding the root cause, digging into the soil, and making sure that we're all on one level. So if you guys need anything, definitely reach out. I can tell you that so many more people are interested in functional medicine. We have a waiting list for about a month. So if you guys are interested in getting in, please, please, please call, get your appointment. Let's get you on the schedule because again, we're having people that are wanting to get in right now and we can't. We have that waiting list. We have people that are pretty booked out. So definitely let us know if we can help you and if you guys have any questions. And again, like I said, even just getting through this winter, I know a lot of people are really concerned about COVID or viruses or just themselves not being healthy. Become an established patient. Get your blood work done. Get your stuff figured out. And then we can put you on an immune boosting supplement. We can do the immune boosting IV. I do it every other week. I feel amazing after I get my immune IV. I'm exposed to lots of people, lots of illnesses, lots of kiddos who are coughing, sneezing, whatever in my face. And so I need to make sure that I stay healthy. So I do the immune IV every couple weeks and I feel awesome. And I have gotten through this entire year without anything. And it feels good. It feels good to do that. So our immune systems will really respond as much as we let it. So again, just if you guys are wanting certain protocols, wanting certain things do you feel like will fit your lifestyle, like now is the time to do it. Get in, get your appointment. Let's get you on a protocol. Let's get you on the road to recovery for health. Let's make sure that we're not dealing with any chronic illnesses, comorbidities, diseases, illnesses, whatever the case may be, and put yourself first. Again, like I said, the biggest thing I can say, do not be a statistic. Stop being a statistic. We don't want to be a statistic. We want to rise up against that. We want to be healthy. We want to be living. We want to be thriving. You guys have a great night.